So in this video, we're going to talk about the diagnostic criteria of dependent personality disorder. It's more complicated than it seems. As with all personality disorders, they're tough to diagnose. This one's particularly tough because a lot of the time it's what's called ego-syntonic as opposed to ego-dystonic, which means that it's consistent with what you want. It's not something you necessarily want to change because it's consistent with your ego, with yourself. So we'll talk about the different criteria and then we can talk about some of the management options. So if that sounds good, then let's get into it. But before we do, I just wanted to say hello. My name's Sil. I'm a junior doctor working in Sydney, Australia. I'm really interested in mental health and making videos that educate and empower people about mental health issues. So if that sounds like your cup of tea, then consider subscribing. Okay, let's go. So dependent personality disorder is really characterized by a sense of inadequacy that is so deeply rooted that basically no decisions can be made independently. Everyday decisions like where to go for dinner and big life decisions like you like this house or that house to purchase or something like that. It's essentially having really significant self-esteem issues to the point where you just don't think you could do anything by yourself. They need their kind of anchor. And their anchor could be a parent or their spouse. And the key thing that they're lacking is assertiveness. They can't kind of assert themselves. And that's one of the core components here. So that's a bit of a synopsis of what it is and what it's like. Let's look at the actual traits and then you can see how it relates. So here we are in the DSM. This is the Diagnostic and Statistical Manual. And this is what psychiatrists would use to diagnose any mental health condition. I should just make a point quickly about personality disorders. These are difficult to diagnose and take a long time to diagnose. You need to see people over multiple visits. So please don't come away from this video thinking you can diagnose it based on one YouTube video. You have to see a mental health professional. But if you identify with some of these traits, that could be a motivator for you to go see a mental health professional. So that's why I'm making this. Okay, so here we are, dependent personality disorder. Let's get into it. So it's really about this pervasive and excessive need to be taken care of. And it leads to this submissive and clinging behavior and fears of separation. And it begins in early adulthood and presents in a variety of contexts as indicated by 5 or more of the following. So let's break this down a little bit. We have this need to be taken care of, which comes from that sense we were talking about, the inadequacy, the fact that you don't think you could take care of yourself. You couldn't live independently, so you need another person. Usually it's one person, it could be multiple though. And that's what leads into this submissive and clinging behavior. Personality disorders are by definition pervasive, they're long-standing. They're not like acute events or brief episodes, they're really long-standing traits. And let's get into the traits now actually. So number 1 is they have difficulty making decisions, everyday decisions, without an excessive amount of advice and reassurance from others. This is what we were talking about before with making plans for something as simple as dinner. The second trait is about needing others to assume responsibility for most major areas of life. So where do you live? Do you want to have kids? You know, these big decisions, when someone's like, okay, what do you think about this house? The person with DPD, dependent personality disorder, might just say, oh, whatever you like, honey, like whatever you like, you'll be right. And it's like, oh, you know, people need to have this shared decision making. And this can lead to a pretty miserable life. Like, say for example, someone doesn't want to study, I don't know, medicine, and they're so dependent on their parents' kind of assurance or approval that they do medicine to make their parents happy, but they didn't really ever want to do it. That's not gonna make them really happy because it's not what they want to do. They might prefer, I don't know, maths or something. And 2, it might not make for a good doctor, or they might not be good in their role, whatever it is, because they're not doing it because of personal values, but for the assurance from their kind of anchor person. Okay, moving on. Number 3. They have difficulty expressing disagreement with others because of a fear of loss of support or approval. So this is really important because this is when something's happening that they don't agree with, but they would never even think to bring it up because of the risks, that their perceived risks of retribution. So the 4th criteria is that one has difficulty initiating projects or doing things on their own. And this is usually because of a lack of self-confidence in their judgments or abilities, rather than actually a lack of motivation or energy. So say they want to, say they genuinely want to paint a picture. You know, they're artists, and they want to express themselves creatively. It's really hard for them to kind of do that because of this lack of self-confidence. And then they might do things to seek the appraisal of someone else, like clean the house instead. But then even when they clean the house, they might not feel like they're doing a good enough job, and they need reassurance for that as well. And you know how it can be very painful to have this condition. Because no matter what you do, you never feel like what you're doing is good enough. The fifth criterion is they go to excessive lengths to obtain nurturance and support from others, to the point where they'll volunteer to do things that they find unpleasant. So one could imagine the relationship where the partner really enjoys, I don't know, playing chess, but the other, person who has dependent personality disorder hates it, but they will do it just to make the other person happy, and obviously probably always lose so that the other person is happy. The sixth criteria is about feeling uncomfortable or helpless when they're alone because of these false fears of being unable to care for oneself. And so when their partner or anchor needs to leave for a business trip or whatever, that can be an extremely anxious and stressful time for someone with dependent personality disorder. And the next criteria talks about when, instead of leaving for a trip, they actually break up. So urgently seeks another relationship as a source of care and support when a close relationship ends. So when one partner leaves someone with dependent personality disorder, there's a very little kind of single stage. They're straight back on it. They're looking for someone who can give them that assurance that they're craving so much. And the final eighth criteria is this unrealistic preoccupation with fears of being left to take care of himself or herself, or themselves. This is taking up a pathological amount of brain space. This is this underlying fear that they'll end up alone and that they won't be able to manage. So those are the 8 criteria. Is there help? Is there stuff you can do about it? Absolutely. Of course, you need to be motivated to want to change. Some people aren't. Some people, will have this disorder. Maybe they have a parent that raised them, and the parent was maybe also had dependent personality disorder and kind of projected these traits onto their child, and the child so happened to develop with them, and the child feels at peace with doing whatever makes the parent happy, and not looking for partners in life, not getting promotions at work, staying in one country, staying in one place, so that they can keep living at home with their parents, etc., etc. You get the picture? So if they're happy or at peace with their kind of set of traits, personality traits, then they might not want to seek any help, and they don't have to change it. And at that point, it's very debatable whether this is technically a disorder because they're happy with it. For something to be called a disorder, it really needs to be called functional impact. And so if it is something they want to change, if it's ego-dystonic, because they don't want these personality traits that they have, then there is help they can do. And it's really around psychotherapies and talking to therapists and psychiatrists, assertiveness training, group psychotherapy, all these things, even cognitive behavioral therapy, all these things can help. So I guess as a closing point, if you identify with any of these traits or anything that I'm saying, go talk to a mental health professional to start the conversation. You don't need to worry about what to say. Just get through the door. Just get to the door. They'll take care of the rest. That's their job to worry about what to talk about, okay? So don't stress it. It's a great idea, and I wish you guys all the best. If you enjoyed this video, please consider leaving it a like. That actually helps me a lot personally. So thank you for that if you do it. And you can consider subscribing as well and leaving a comment down below to start a conversation. There's always really interesting comments. So please consider doing that. All right, have an absolutely lovely day, guys. Bye.